Hello everyone. This presentation is on Gui Zhi Tang, also called cinnamon twig decoction. It appears on the California Acupuncture Board Examination Herbal Formula list. I will review its traditional pattern, a short hypothetical patient case, 3 potential drug-herb interactions, and a practical management plan. The purpose is educational. Herbal formulas are selected by pattern, but medication safety still requires attention to pharmacology, dose, duration, and the individual patient. Traditionally, Gui Zhi Tang is classified under release the exterior. A representative pattern is Taeyong wind strike pattern with spontaneous sweating, aversion to wind, mild fever, and a floating moderate pulse. Important ingredients include Gui Zhi, Bai Shao, Shen Jiang, Da Zhao, Gan Kao. The key clinical idea is pattern matching. A formula can be appropriate for one patient and inappropriate for another patient with the same biomedical diagnosis. Before treatment, I would also screen for red flags, confirm that urgent biomedical evaluation is not being delayed, and review the exact medication and supplement list. My hypothetical patient is 38-year-old woman with recurrent chills, spontaneous sweating, and mild headache. History of hypertension and type 2 diabetes. The current medicines are hydrochlorothiazide, metformin, aspirin. This case gives a plausible reason to consider Gui Zhi Tang, but it also creates interaction questions. I would document the tongue and pulse findings that support the pattern, confirm the diagnosis, and ask about allergies, pregnancy status when relevant, kidney and liver disease, bleeding history, and use of over-the-counter products. Medication reconciliation is essential because many interaction risks come from the combined physiologic effect rather than from one single herb. Interaction 1 is Gan Kao plus hydrochlorothiazide. The mechanism is, licorice can promote sodium retention and potassium loss. Thiazides can also lower potassium. The clinical significance is moderate, especially with longer use, hypertension, edema or low potassium. My management plan is monitor blood pressure and potassium, avoid extra licorice, and prolonged unsupervised use. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. Interaction 2 is Gui Zhi plus glucose-lowering therapy. The mechanism is cinnamon-related constituents may have glucose-lowering effects, so additive lowering is possible. The clinical significance is usually low to moderate. Evidence varies by preparation. My management plan is monitor glucose when starting or changing the herbal dose. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. Interaction 3 is Shen Jiang plus aspirin. The mechanism is ginger has antiplatelet activity in laboratory and some clinical data, so bleeding risk may be additive. The clinical significance is usually low at food level doses, more relevant with concentrated products or multiple antithrombotics. My management plan is watch for bruising or bleeding and avoid stacking high-dose ginger products. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. In conclusion, Gui Zhi Tang may be reasonable when the patient's presentation matches Taeyong wind strike pattern with spontaneous sweating, aversion to wind, mild fever, and a floating moderate pulse. The main safety principle is not simply to label herbs as safe or unsafe. Risk depends on the specific herb, preparation, dose, treatment duration, the patient's organ function, and the drugs being taken. I would use a reputable product, start conservatively, monitor the most relevant objective values, and communicate with the patient's physician and pharmacist. This presentation is for education and does not replace individualized medical care. Key references include the California Acupuncture Board Examination Formula list, standard Chinese herbal formula texts, such as Bensky and colleagues, Chen and Chen's Pharmacology and Applications text, and evidence-based drug and herb interaction resources. Thank you.